Well, look, I'm very excited to hold this press conference this morning. I'm about to get on a plane and go to Washington, D.C. with about 50 members of the U.S. Conference of Mayors to meet with the Biden administration to, quite simply, make our cases known in our respective cities, and for want of a better way to say it, make sure that Hawaii, Honolulu, is at the front of the line if, in fact, we're going to be asking for more financial subsidies. You know, all of us are facing this problem. All municipalities have housing problems, some maybe perhaps more than others. We know here how acute it is. So this opportunity to go back to Washington in this setting with this agenda is very exciting to me, because I'm hoping that we're going to be very successful with that. I'd like to give you some details, and I'm going to call up Anton to bring you into it, but we're very excited about this time. Anton, come on up.
Thank you, Mayor. So his trip really is right in the sweet spot of the city strategy for homeless and housing. So really, as complex as the homeless situation is, the strategy really involves two pieces. The first piece is everything creatively we can do to convince somebody to engage the system. And you're going to hear from some gentlemen that are really part of those creative solutions. The second piece is constantly analyzing our resources to service those decisions. And key to those resources are housing, right, that we can put people in housing. So a key area that the mayor's going to be pitching for us is increasing our amount of HUD-delivered Section 8 vouchers. And so every couple of years, we issue a waiting list. We open up the waiting list, and we get 15,000 applications, of which, randomized by a computer, we have 3,000 that we will work through and then give vouchers to be housed. And these folks that have the vouchers are paying about 30% of their income, and so it releases the rest of their income for their living expenses. In addition to that, we also learned, and we've been very successful here, because of our rent and utility relief program, to keep people housed and keep them from becoming homeless. So in addition to the Section 8 vouchers asked that the mayor's going to take back, also a program of specialty vouchers like we did with the Oahu Housing Now vouchers. That took a section of people that were out of the HUD programs, and we offered vouchers to, and we were able to house 308 families and over 850 people off the street in 1 year. And over 94% of those people are still housed today. So we're going to look for another specialty housing program like that the mayor's going to ask for, and the expenses that go along with it. We need beds of many flavors. We need beds for different people in different stages, and we couldn't be sending somebody better than the mayor, as you know, to make these applications and pitches for us. We're really looking forward to upping the amount of resources we have to address the folks that want to engage the system. Thank you.
Aloha, Sam Moku, Mayor's Homeless Coordinator. This is a great opportunity for the city and county of Honolulu to continue what we're doing already in placing our homeless in various, as Anton said, beds of many flavors. And these beds that we're about to move on into are permanent vouchers for our homeless population. And in the continuum of homelessness, this is probably the most important part of those who are homeless in our community that we don't see. They are the working homeless that live in their cars on the streets. They maybe get services from IHS or some other service provider, but they need that one lift to get themselves into permanent housing. And these are the people we're going to help. So thank you very much.
Good afternoon. I'm Jim Ireland, Director of Emergency Services. I run the core team for the city, Crisis Outreach, Response, and Engagement. You know, we have had great success with CORE in the last year especially, and it's only accelerating. You know, I think we have the stars aligned, if you will, with Mayor Blangiardi, the governor, city and state homeless coordinators, Anton, and all our respective teams to really make a huge difference in homelessness. And I think it's a model that other cities around the country are gonna look to us in the future for their own crises. And I tell our own team, if this was easy, it would have been taken care of already. And we see this as a problem across the country, but I think our innovative strategies here will really let Honolulu lead the way. You know, the core team engages people right on the street. And I'll tell you a brief story. There was a gentleman, 82 years old, lived here 50 years, worked his whole career in the hotel industry, had a death in his family, found himself homeless. He was on the sidewalk on Ward Avenue for almost 2 years. People knew him walking by. He would take handouts, but never really ready to accept care. Well, about a week ago, he did accept care. The core team was able to get him to the ER and then ultimately into medical respite. He has some medical issues. He's going to need some therapy, but he's in one of our medical respites. You know, and we didn't have medical respites a year or two ago. And so now that we have a medical respite, there's a place for these folks who are not sick enough for the hospital, but too sick for the shelters. He's not able to do, you know, walking or bathing and stuff on his own. He needs a little help. But now that he's in medical respite, you know, we need to transition him after physical therapy to some type of housing, whether it's a Kauhali or Section 8 housing, independent living, or these vouchers we'll get. We do have to get him out of respite to make room for somebody else to get into respite. So what the mayor's doing is providing an end place for folks who are coming through our kind of homelessness corridor, our system, whether it's medical respite or shelters, but there has to be throughput so we can make room for the next person. So I think this is just part of a continuum of care that we're offering from core to housing and everything in between, that we're really going to see a major difference in the approach to homelessness and our successes. You know, and I tell our team, we can be proud of our numbers, we're getting people off the street, but at the end of the day, we want to be able to drive through Chinatown and drive down King Street and drive down Kalakaua and go to many places on the island and not see people having to live on the sidewalks or live in encampments, that they can be in some type of sheltered, whether it's transitional, temporary, or permanent housing. That's our goal. Thank you.
So to kind of sum it up, if you will, that our challenge in dealing with homelessness really is on a couple of different levels, and it's a very complex problem, as we all know. But this agenda now, where we can actually prevent people from becoming homeless, you know, we know full well the math doesn't work. More than 60% of our families are living paycheck to paycheck. It is easy out there for somebody to go from being sheltered to unsheltered. And this allows us to intercept at a critical point in time to prevent them from hopelessly becoming homeless. So we're dealing with the prevention aspects, and I'm really proud of the work you know, Anton and the Department of Community Services have done this year, along with our Office of Economic Revitalization. We were one of the stellar cities in the country in our performance with rent and utility relief. We've talked about that. That was not insignificant. That was unprecedented. It was over $300 million affecting more than 24,000 families. This here gets more into a tailored approach with these individuals, and at the same time, as Jim just told you, our ongoing efforts now to remove people who are from the streets and be able to take them through a transition, if you will, from that sort of lifestyle into something that's more permanent is exciting for us, because at the end of the day, it's those couple of thousand people we know who are unsheltered, who are out there on the street, many in need of medical care, many in need of just a lot of things, but more than anything, a place to be taken care of. That's a primary responsibility for us. So I'm very excited. This is the first time now in 3.5 years. I'm going to go back to Washington. Along with the other mayors, like I said, they know we're coming. They know what we're asking for. We want to be sure that Honolulu, as I mentioned earlier, is at the front of the line. And we're really excited about the potential of this, because it will make a difference. We need every resource we can get. You know, and with these federal monies, this is really critical to our efforts, our plans, and how we want to execute in taking care of our homeless people, and more importantly, even preventing homelessness. So with that, I'd like to turn it over to any questions you might have. It's the same concept as housing first. I don't think it is. This is, you know, this is really trying to get our housing vouchers for those people who are income eligible. It's a little bit different than housing first. Okay. Anything you want to answer to that? This is my housing first expert, Victoria, okay?
Thank you, Mayor. So the concept of housing first is really two different concepts. One is just the words themselves. And there was a program about 12 years ago where they said, if you take somebody and you put them in housing and you surround them with services, that will end homelessness. And it works many times, but many times it doesn't work. And so, you know, there were people that said in 10 years we would not have homeless, and it's just not the case. The economics of a place that has a high cost of living really is the main driver of homeless. There's different issues to deal with on the street, but that's the main driver. Housing First as a program is really state-funded money that comes to the city that we then extend to service providers, and then they would have vouchers that they could give to people within certain programs they have. So whereas Section 8 vouchers the city issues directly, Housing First is money from the state, it's not federal money, goes to a service provider, and then they issue those vouchers for housing.
I don't know if there's a specific dollar amount. I think it's once I get there and really be able to assess what's out there, let's just put it this way. We're going to try to get every dollar we can. And we intend on being aggressive about that. We think look, we've had conversations about my attending this, and it's been sort of a select group. So they're aware of our housing needs here, and we're going to be very aggressive. And we'll talk about just what that means when I get back. That's it, Well, that's a good question, because look, when we talk about the unsheltered population that's out there, and talking with our homeless service providers, many of them have been on the streets for even 10 years or more. And you just heard Jim talk about the 82-year-old man that was out there for 2 years or more. Those veteran homeless people that have been out there, many of them suffer from mental illness and drug addiction, or some kind of addiction. And so they're not easy to deal with. They don't like rules. They don't want to go inside. It's a lot of stuff. But that's where having the proper facilities and medical care to help stabilize them, help transition them, this is the kinds of things that have to take place. And a number of them can be stabilized. They've just been out there without medication or without any kind of proper care. So we're going to be very aggressive with that. But it's sort of what Jim said. We're now teeing it up in this combination of city and state resources together, where we have a mobile crisis unit capable of picking them up in the streets and also building trust. There's a lot that goes into that relationship. They just don't go, they're out in the streets working cars. They know who the people are. Every one of them out there has a story. You have to build that up. But being able to pick them up was the first part of it. The last two legs have only come into existence within the last few months, and that has to do with having places to bring them to, and even more importantly, providing the medical care in between. And as Sam mentioned, in working with the state, you're going to see more Kalhalis coming up. You're going to see different things like that that help us stabilize the situation. So, but this here is for those families that are working really hard, and they just they can't quite make the math work. And this is where we can step in and keep them in a roof and have life be as normal as they can for them. And this is a really important part of that whole equation. We want to prevent people from becoming homeless. That was one of the things on the rent and utility relief program that I was so proud of. We actually had hired mediators to deal with potential evictions in anticipation. This was because of COVID, of what might have been an onslaught of homelessness. All of that was mitigated. And so it does take money. Money helps in this equation in a big way. And so that's what this is about. We're going to go get the money to help these people.
Yes, Anton Krucky again from Community Services. Yes, when we opened up the waiting list, in 5 days we got close to 15,000 applications. And then what we do with those applications is the computer randomizes us and gets us down to a list of 3,000. And then we just take the order that the computer gives us and we work each situation. They have to qualify. They have different pieces in there, but that's tells you about the need, right? Well, we address about 100 a month, right? And of those 100 a month, we issue the vouchers, and those folks and their Housing Choice Vouchers. So they get once they have the voucher, then they look for the places to say that to use those vouchers. And what the vouchers allow them to do is they only pay 30% of their income, and then the rest is paid by the voucher directly to the landlord. So the Section 8 is randomized, so it doesn't specialize to your question about whether or not it's directed at homeless. But that's why we're looking, in addition to the mayor asking for additional Section 8 vouchers that he'll be doing, we have a specialty voucher program that we're going to have them ask for, like we had before, which allows us then to look at other populations and see if we can really move those along as well. So that's a great question.
Yeah, when we're dealing with Section 8 vouchers, we really are dependent upon landlords being sensitive. It's not so much as a special incentive. What they have knowledge of is that these people will be able to pay their bills, and that can be reassuring for a lot of them. So that's the whole idea here, is to stop people from seemingly slipping into the kind of poverty that could result in homelessness. This is what this is, and that's why it's so gratifying. And I can just say this, and I speak for our team. we feel this. You know, you talk about 15,000 and being able to process what it comes down. Those are big numbers. It speaks to what that demand is out there. And so that's why we're excited if, in fact, we have an opportunity like this to go and maybe aggressively, unprecedented, be able to come back with even more resources so we can handle more people, because those numbers don't go away. There's only so much we can handle because money is finite, resources are finite, but if we can get more money, more resources, we can do more. And it's in all simplicity, that's what this is about.